Hope everyone's doing good today. We're going to work on the lymphatic disorders. So, lymphatic disorders deal with the lymphatic system, which is a series of vessels that draw excess fluid away from the tissues. It also has an immune system function. So everything we're sort of going to talk to deals with this lymphatic system and either the lymph nodes or the tissues or organs that go along with it. So the first type are lymphomas. Lymphomas are malignant neoplasms, so cancers involving lymphocytes, proliferation in the lymph nodes. So the lymphatic cells are growing too rapidly and they're causing a cancer. And one thing that we always worry about with cancer is it spreading through the lymphatic system, because this is a very it's a highway for cancer, so it can be very dangerous and spread. The specific causes have not been identified. However, we have found out that adults that had a lot of radiation are more susceptible to lymphomas, and when they were children, had a lot of radiation when they were children. There's two main types: Hodgkin's and non-Hodgkins. Okay, so it's not Hodgkin's lymphoma; it's non-Hodgkin's lymphoma. And they're distinguished by how it kind of spreads and where the neoplasms are located in relationship to each other. So Hodgkin's lymphoma means it usually starts at one place and then it spreads from there. It's very organized. Non-Hodgkin's, it's kind of more random throughout the body and widespread. So Hodgkin's lymphoma initially involves a single lymph node, and it's going to grow very quickly, and it's usually going to be non-painful and non-tender to the touch. The cancer would then spread from that one lymph node to the adjacent lymph nodes, and then throughout the lymphatic system to the different organs. So it's going to metastasize and spread. It seems that the T lymphocytes are the defective cells, and inside the lymphatic system, T lymphocytes are defective, and lymphocyte count actually will decrease. You will see the presence of Reed-Sternberg cells. These are large, giant cells that are normally found in the lymph nodes. There's 4 subtypes, and to distinguish between each subtype, you have to look at a biopsy of the lymph node. Some of the symptoms are: first, it's usually a painless and large lymph node. Later, the spleen can grow, and we can get splenomegaly, which is just enlarged spleen, and other enlarged lymph nodes. It spreads from one site to the next in a very organized way. Typically, you also see a lot of the general signs of cancer, and this is something you sort of kind of want to commit to your memory, because we're going to talk about cancer more. Weight loss, anemia, low-grade fever, night sweats, and fatigue. So those are some of the signs of cancer. And then the treatment would be radiation, then chemotherapy, and surgery. So we're going to radiate the lymphoma, and then we use chemicals and surgery to remove it. So typically we stage lymphoma with 4 stages, and stage 1 is where there's one single lymph node. Okay. Stage 2 is more than one lymph node, but on the same side of the diaphragm. Stage 3 is where it's on both sides of the diaphragm. Okay. And stage 4 is widespread, including the liver and the spleen. So very organized spread, so it spreads from one location to the other and gets progressively worse. That's Hodgkin's. That contrasts with non-Hodgkin's, which is located a little bit everywhere. Staging and prognosis is dependent on the number of lymph nodes involved and then the location. When they're sort of localized, it has a very good prognosis. When it spreads a little bit more widespread, that's when you have a little bit more problems, and the prognosis is not as good. Non-Hodgkin's lymphoma is on the increase due to patients with HIV. And HIV impairs the lymphocyte, the white blood cells, and therefore you're unable to fight against certain bacteria, and also unable to fight. Your immune system is not functioning well, so you're unable to do cell-mediated immunity. So with HIV, you're also unable to kill or apoptose any cells that are affected with viruses or any cells that are mutated, because we're not able to recognize that something's wrong with the cell and we need to destroy it. So then it becomes a lymphoma. It can become a lymphoma. It's very similar as far as the clinical signs and symptoms, but it's more difficult to treat because the tumors are widespread and not localized. So it's the same thing, a large painless lymph node, and then it's widespread over throughout the body. The next disease we're going to talk about is multiple myeloma. And with this is another neoplastic disease that involves it actually involves the bone marrow. And we have an increased production of plasma cells. And plasma cells are cells that produce antibodies, and they help with the immune system. Multiple myeloma has an unknown cause. It occurs usually in older adults, and the other blood cells a lot of time are impaired. So first we kind of see lots of tumors in the bone, and they're producing a lot of plasma cells, and so you're going to have loss of bone and severe bone pain. And prognosis typically with multiple myeloma is very poor. So here it is in the skull. You can see right here, little spots, okay, where it's decreased. Signs and symptoms of multiple myeloma is onset is usually insidious. That means it's very slow and gradual, and you really don't know what's happening until it's too late. So it's very malignant by the time diagnosis occurs. You have lots of bone pain and deep bone pain, anemia, bleeding because you're not able to make the red blood cells and the thrombocytes, impaired kidney function, eventually failure. With chemotherapy, median survival rate is about 3 years after diagnosis. Next is lymphedema, which is the obstruction of the lymphatic vessels. This is the most common form is actually congenital. That means you're born with it. And the extremities will swell because of lymph accumulation. Okay, so lymphedema is just a swelling of those tissues in the extremities because of lymph accumulation. So the lymphatic vessels are blocked. Some of the treatments include diuretics, which are going to increase the overall amount of water in your body. Bed rest, and also keeping it elevated, so you don't want it swelling towards the extremities like the feet. And you can also massage the area to kind of push it back up to keeping everything moving along. One particular type is called Elephantitis, which is lymphedema, which is caused by parasitic infection, and the parasite goes in and lives in the lymphocytes, and it's going to cause in the lymphatic vessels, and it's going to block them and cause extreme swelling of the extremities, particularly the legs, breasts, and genitalia. And because this swelling is chronically swelled, it's going to cause the subcutaneous tissue to thicken, and it's going to cause it make you more susceptible to infections and skin ulcerations because the skin is stretched. You can see fever along with it. The treatment is first to kill the parasite, and then you can do some of the other diuretics and things. The next disease is called Castlemans Disease. It's a rare disease, and it actually involves just overgrowth of the lymphoid tissue. So it's where the lymphatic tissue, lymph node actually grows really large. There's a unicentric form, which is just one huge growth of lymph node. Then the multicentric form is where there's lots of lymph nodes in the tissues. With one, it's not that bad. You can remove it. With the multicentric, it has a little bit different because you have to find out what's causing it, and it can have severe effects on the immune system.